In this presentation, as a group, we are identifying the cultural impact on the health of Aboriginal and Torres Islander population living in the remote area of Australia. The social determinants of health impacting health promotion on diabetes mellitus, cultural competence, and safe care as a registered nurse. Link between culture and health. The health of Aboriginal and Torres Islander person is not just the physical aspect of health, but rather the emotional, social, and the cultural well-being of the whole community in which the person has raised and grown. The Aboriginal health is defined as being together to bring wellness in the whole community. Aboriginal communities have a strong connections to their culture and traditional land. The disconnection from their land and the exclusion of the culture after the colonization had a significant impact on their well-being. They suffered deep grief through political and historical events by losing their cultural value, identity, and their sense of belonging to the country as well as their health status and well-being. The laws and the new lifestyle which was introduced by the colonizer were strange to the Aboriginal people. All these factors had a serious impact on the health of Aboriginal people. Aboriginal and Torres Islanders, as a disadvantaged community, are more likely to develop chronic diseases such as diabetes mellitus. According to data, Australian Indigenous Health Info, the rate of the diabetes among Aboriginal people is 3 times greater than non-Aboriginal people. There are many contributing factors in the development of diabetes among Aboriginal people, such as social and cultural influence of westernized lifestyle, as well as historical events. Many Aboriginal and Torres Strait Islander people, especially in the remote area, avoid seeking professional help due to the language barrier or different cultural norms and practices. According to studies, there is a significant gap between Aboriginal health compared to non-Aboriginal population in Australia. Therefore, it is important for health professionals to understand how to treat an Aboriginal patient in a culturally safe and competent manner to deliver the best possible care within Aboriginal community. Social determinants of health and its impact. Social determinants of health refers to how a person is raised, lives, grows, and ages in conditions or situations. Some of the social determinants of health are healthy child development, social support networks, education literacy, employment and working conditions, and genetic characteristics. Social determinants outline people's wealth, resources, and health status. It is responsible for preventing inequalities in healthcare system via health policies and programs and identifying vulnerability. Diabetes mellitus is an acute disease caused by insufficient insulin release or by insulin resistance. leading to high blood sugar level where body cells cannot use carbohydrate. It occurs mostly in older age, lack of physical activity, obesity and substance use. In remote area, Aboriginal Torres Strait Islander people are at high risk of developing diabetes than compared to non-Aboriginal Torres Strait Islander. One of the reasons is in 1880s, when the European colonists invaded Australia and took over the land from the Aboriginal and Torres Strait Islanders, they brought in with them diseases such as smallpox, influenza, and measles. These leads to death and eventually decrease the population, and majority of the people inherited these diseases. According to Australia Bureau of Statistics 2014, in 2012 the second disease leading to death was diabetes mellitus, and in remote area it was 7 times higher than any other areas. Furthermore, in remote area, lack of employment can also impact on the social determinants historically. Unemployment leads to poor diet, lack of health care, physical activity, obesity, illness, financial problem, higher risk of death, and substance use. For example, 1.1 million Aboriginal and Torres Strait Islander had at least one of the 8 deadly diseases in 2014 and 2015. Cultural competence and safe care. As remote communities follows a certain social capital, which is defined as a binding community by understanding what helps cooperation among and within the group and the values shared. To be able to approach the community, one must establish trust in the community. Introducing oneself to the elders, health council members, traditional healers, and other appropriate people among the community is a good start. Learning the local history, learning to listen more and speaking less, as well as following the cultural norms could benefit in gaining knowledge about the community and culture. Trust is very valuable to the Aboriginal and Torres Strait Islanders, as their history and tradition depict a sense of belonging. Elders are often active in sharing stories about their land, culture, and language. This has led the Aboriginal Community Controlled Health Organization to accept these influence and develop social and emotional health well-being units to work and empower them to reconnect with their practices. However, the cause of health gap in the Aboriginal and Torres Strait Islanders are due to various factors, such as complex interactions in the social determinants of health, as well as poverty. Approaches to tackle these problems are implemented to prevent, promote, and protect. Population health approach is a response by the community and or society to reduce diseases, protect and promote with evidence-based information. It requires systematic assessment and or planning, attending to treatment guidelines, relevant clinical information and continuous follow-up. but it, however, can fail if the patient lacks follow-up, coordination of care plan, and inadequate education in the community. Culturally safe nursing care in remote area with Aboriginal and Torres Strait Islanders who has diabetes, one must provide patients with adequate evidence-based information, provide patient-centered support. As diabetes is an incurable disease, providing ways to manage it can help the patient, such as organizing support groups. To overcome the problem, healthcare workers need to prepare and take care on courses. Learn more as remote area require more advanced and extended scope of practice. In summary, this presentation has discussed the link between culture and health of Aboriginal and Torres Islander population living in the remote area of Australia. The social determinants of health impacting health promotion, the need for cultural competence and safe care when handling Aboriginal and Torres Islander patients from remote areas. As a registered nurse, one must go to the community and promote healthy eating and or provide educations to the elder, where the elder can then educate the community group, or the nurse can educate on healthy eating and dieting to prevent diabetes at an early stage possible and to manage the disease. It is important for every healthcare professional to think critically and realize the importance of understanding the culture of the patient, to provide safe care and to contribute to closing the gap in health promotion. Let us watch a video on the need of cultural competence in healthcare. Thank you for your time.
There's an abundance of literature addressing costly healthcare disparities in the U.S. Disparities are influenced by a number of factors: culture, environment, and socioeconomic status, to name a few. Reducing healthcare disparities requires an understanding of these factors and how they influence patients and providers. Stephen Covey once said, "We see the world not as it is, but as we are, or as we are conditioned to see it." Each culture has its own set of beliefs and values that affect how patients perceive everything around them, including their health care. Patient compliance and understanding are also influenced by socioeconomic and social factors. Patients don't leave their beliefs at the door when they visit their provider. Culture shapes our thoughts and behaviors. It influences the way patients respond to medical services and the way providers deliver those services. Healthcare providers today must be mindful of the social, cultural, and linguistic characteristics of each patient. This type of awareness is called cultural competence. What happens around us is processed within us and filtered through a cultural lens that helps us interpret every experience we encounter. The meaning we attach to what we see and hear is based upon who we are and what we believe. Ignoring cultural differences diminishes our ability to effectively communicate. This leads to communication gaps, confusion, frustration, and if this relationship suffers, so do health outcomes. But a culturally competent provider demonstrates a respect an understanding of cultural differences and considers how others might react to certain experiences. This helps to reduce healthcare disparities, improve health outcomes, and motivate patients to become equal partners within their own care team. And working as a team with your patients is the best strategy for accomplishing your goals. So you want better health outcomes and greater patient satisfaction? Respect and value cultural differences. Examine and evaluate your own cultural attitudes, and make appropriate adaptations to patient care. Understanding your patients will aid them in understanding their health. Cultural competency will promote compliance, mitigate healthcare disparities, improve health outcomes, and encourage patients to become your partner in their health.